name is Aisa D. Hamza. I am going to demonstrate a urinary catheterization. Urinary catheterization is the introduction of urinary catheter through the urethra into the bladder for installation of removal of fluid. The purpose of it is first, to relieve urinary retention, second, to obtain a sterile urine specimen, third, to measure the residual urine remaining in the blood after voiding, fourth, to control the urinary incontinence, fifth, to provide access for instilling medication into the bladder, sixth, to maintain empty bladder during surgery, and seventh, to maintain early urine production in serious ill clients. The material needed is external dutching tray, bedpan with cover, waterproof underpad, and bath blanket, and the tray containing the following of pick-up forceps, working forceps, lubricant, betadine, sterile dry cotton ball, catheter, sterile catheterization pack containing of drape, OS, kidney basin, and equipment for the indwelling of catheterization is polycatheter, sterile syringe, and distilled water, plaster, and urine bag, and gauze neck lamp. First, check the doctor's order. This is because the urinary catheterization is only done under the medication order. Identify the client and establish report. Good day, ma'am. I have some question for you. What is your first name and last name? What is your date of birth? Okay, good. I'm just gonna check in your ears. Okay, ma'am. Thank you. To ensure the right client and elicit cooperation. Assess if the client is allergic to iodine and plaster. Hello, Mrs. Smith. Are you allergic and iodine or plaster? If the patient says no, then go on to the procedure. Explain the procedure to the client to elicit cooperation. Good day, Mrs. Smith. For today, I am going to introduce a catheter through urethra into the bladder, and prior to do that, I am going to do a perineal care. If the client say yes, then go on to the procedure. Gather the material needed. To organize remote efficient time management. Next is provide the privacy by closing the door or pulling curtain, because the client has the right to protect it from being exposed. The doors are recumbent position with their feet apart and drape the client. It is because good visualization of meatus is very important. Performing hand washing is prevent the spread of microorganisms. I assume that the patient is placed in a dorsal-recumbent position with the feet apart, and I am gonna pour the sterile water solution. Is I'm gonna swipe the labia, which is inside. We're gonna do the roll of 7 motion from the clitoris down, then discard the cotton ball used. Get another one and do it the opposite side with same stroke. This is cleansing the perineal area, prevent the introduction of bacteria, prevent the spread of the microorganism. Discard the used working gloves to prevent the spread of microorganisms and sanitize the hand. So just assuming that this is a sterile kit, it's away from us and side and toward. Remember that the border is not sterile, the inside is the sterile of the patient, and the one is for the exposing only the genital of the patient. So I assume that I have a 10 cc sterile water, and I will attach the water syringe to the catheter and to the drainage bag. But first I will try if it will be inflate the balloon. So yes, it is good. It will deflate. And I will put inside to the kit. I am going to lubricate 1 to 2 inches of catheter tip. Next, with the using of non-dominant hand, I will spread the labia because I need to be able to fully visualize the urinary meatus. Okay, Mrs. Smith, I'm gonna clean with my dominant hand, get a cotton ball swab from you, then read the cotton ball. Get one to another side, then read the cotton ball. The last cotton ball in the middle, then read. Okay, Mrs. Smith, are you ready for insertion? Okay, Mrs. Smith, take a deep breath for me. At this point, I'm gonna anchor the catheter in place, and now I can insert my syringe. Now I'm gonna give a little pull just to make sure that it's sitting in the bladder, okay? So I'm gonna detach the syringe. I'm gonna remove the drip. So I'm going to place the urine bag to the non-movable part of the bed. I'm going to be placing the urinary bag to the non-movable part of the bed. Then I'm gonna attach the catheter here to lock. Tap the catheter to the thigh to avoid reflux of urine to prevent infection. Place the client in the comfortable position. Document the following: date and time, started and ended, client response or reaction to the procedure, record client output if required. Reporting and recording of information about the procedure must be accurate and timely for continuity of care. Check the doctor's order. Removing a catheter is only done under the medication order. My 10 cc syringe for removal, and depending on the size of the balloon on a catheter, and also the gloves. Mrs. Smith, your doctor order of removal of urinary catheterization. This is not gonna be uncomfortable as it was with insertion. So, pull down the blanket under the tap to the thigh, and take out as much water as you put in, and pull back the syringe when deflating the balloon. Okay, thank you. Deep breath, Mrs. Smith. Okay. I will remove the catheter. Alright, done. Thank you very much, Mrs. Smith. And clean the area. And place the client into comfortable position. Remove the gloves to prevent the spreading of microorganisms. Document the time of the removal and time which client should next voiding time. The reporting and recording of information about the procedure must be accurate and timely for a continuity of care.